All right. As promised, we're back. You know, I mentioned that the topic for this segment is going to be hospitals under Obamacare and how they are being fundamentally changed by the implementation of the Affordable Care Act. And there's an article out in USA Today that's kind of instructive. The way that hospitals are being dealt with in this case is going to, and to use the president's phrase, fundamentally change the nature of healthcare in America. Hospitals are being, first of all, many of them are eliminating vast quantities of staff. They are, for numerous reasons, they are laying off and or firing, and I've done whole shows about the total number of nurses and doctors that have left the healthcare system, specifically related to the Obamacare Affordable Care Act. Now, doctors we know are leaving. There's a lot of them that are vacating the system. They're basically retiring, and many others who were planning on going into medical practice are no longer looking at that as a viable alternative. Or they're looking at a very specialized method of medicine versus the general practitioner concept. But what we have going on in hospitals is a complete divergence from what we've known before. Hospitals around the country are transforming the way that they do business because they cannot survive if they don't. Their administrative organizations are looking at the implications of what the Affordable Care Act forces upon them, and they are being required to change the way that they do business. Now, charity care is a major function of any hospital. Every potential hospital that you would look at has a whole segment of their business that is related to charity care. And when we look at the total amount of charity care that is associated with hospitals, it's a significant portion of their budget, perhaps 30% in some cases, maybe even more in some very high urban areas and things like that, or very economically depressed areas. Don't have to necessarily be urban; they could be rural as well. But what we do know is that hospitals that provide charity care to uninsured people are now going to see a change in the way in which they are dealt with. There's a report out that indicates that the ACA will actually burden those hospitals with penalties if they provide care for you and you have not signed up for Obamacare. Now, I got to tell you, that to me smells of restraint of trade. A hospital is not an arm of the government. A hospital is not a division of the United States of America's federal government. If a hospital chooses to offer charity care that they know they're going to have to write off, that's the hospital's prerogative to do that. In fact, many hospitals are, if you look at, as an example, St. Jude, they provide, they don't bill any parent for the care and the charity care that they give to their children. Now, St. Jude only does children. By the way, it's an excellent organization, very worthwhile. If you can support an organization that offers medical care, St. Jude's the one, because they don't bill the parents at all. In fact, no one who goes to St. Jude pays anything. But they only deal with children, and they only deal with, real life-threatening illnesses. But they take these kids in who have cancer and have, all these different terminal illnesses, and they work to save them. But they don't charge anyone. Now, they may be able to bill an insurance company for some portion, but they never come back to the parent and say, hey, your insurance company will only pay, 20 or 50 or 70% or 80% of this, and you got to pay us the difference. They don't bill anyone outside of perhaps the insurance. And now these hospitals are going to be facing penalties if they provide charity care. The implications of that, ladies and gentlemen, are immense. Does that mean that the next thing we'll see is food banks who offer food to people that don't sign up for food stamps are going to be penalized for doing so? I mean, really, isn't this an example or a symptomatic issue that explains to us the nature of control that our federal government is now exercising across the scoreboard, whether it's federal in nature or local in nature? And is this the vision that our founders had? I don't think so. Churches and local community have been the basis of charity for all of the American history. Many hospitals are religious based in their nature, in their foundation. And so they offer charity care as a known given. They go into the business with the idea of offering charity care. To penalize them at this point is inexcusable. It's un-American. It's immoral. Forget the argument about gay versus straight. Forget the argument about abortion versus non-abortion. You're sitting here talking about penalizing hospitals for offering care to living human beings who need and desire that care because they will not capitulate and kowtow and kneel down before the God of the state. I've got to ask you, how do you justify that? Under any reading of any moral concept, under any reading of any religious doctrine, under any reading of our Constitution and the founding principles of the United States of America. You don't. It doesn't exist. Penalizing hospitals for offering charity care merely because people will not sign up for Obamacare is tantamount to criminal activity. It's criminal in the sense that the United States is placing itself in the position of being a monopoly on health care. If you found out that Exxon said no one can sell any gas but Exxon gas, and any gas station who offers to sell something that is not Exxon gas is subject to a penalty and being fined, you would have kittens. If you found out that Walmart had garnered the ability to say no one can shop in any store but Walmart, you would say that is a violation of everything that we believe in. Free market, free enterprise. Especially if Walmart triples its prices. Especially if Exxon raises the price of gasoline 50 cents a gallon. Why is it okay for the federal government to do the same thing? Why is it okay for the federal government to come in and tell a private hospital how and under what circumstances they can offer charity care, or any care for that matter, in the United States of America? Forget the idea that this is all about insuring the uninsured. We know that to be a fallacy. It's proven. There's no way. I mean, look, we know that the Obamacare message was we got to pass this to cover 30 million Americans who aren't covered. Okay, great. What we now know is that there are some 50 million Americans who aren't going to be covered because they're going to lose their employer-based health care, which the administration guaranteed they could keep. And they're going to lose that and fall onto the uninsured rolls where previously they were the insured. So we know that this is all a fallacy and a lie. But now to take this thing one step further and to say that there are 100 million outpatient department visits and 130 million visits to emergency departments in this country every year, and that the hospitals are going to be penalized if they treat you because you don't have your national ID Obamacare card, is tantamount to a coup d'etat. Think about it. That's what this is really all about, isn't it? Forcing you to become compliant with a national system where all of your information is owned, possessed, and rifled through. Your health care, your financial information, your identification is rifled through by bureaucrats in a large, in these large data centers, hubbed and monitored from Washington, D.C. Tell me that this is not transformative of states' rights. Tell me this is not transformative of your individual right to freedom of speech, freedom of religion, because you're being forced to pay for something which most religious organizations are diametrically opposed to, abortion. And I don't care where you stand on the abortion argument. That's not the sole argument for this. There are 100 more. So for those who would argue about that, leave that argument out. The simple truth is this. Anytime government sits in there and places itself between the patient and the doctor, between the patient or between an individual and someone who's offering that individual something for nothing because they're not compliant to a government program, what have we got? We've got a political monopoly. We've got a police state monopoly. We have a law enforcement monopoly on your health care. I get it. The ACA is going to flood hospitals and doctors with brand new patients. Many, if not most, who have never had medical care up until now because they've been uninsured. The taxpayers are going to subsidize that to a stunning amount. Latest estimates are over $3 trillion. Program was promised to come in at less than $1 trillion. And then, to make matters worse, they're going to penalize and tax those hospitals for failing to abide by their regulations, which determine that if you have not signed up for Obamacare, that hospital is subject to penalty for treating you. It is unjustifiable, unethical, illegal, unconstitutional, and flat out immoral. I've been suggesting all along that the real purpose of Obamacare is not to take care of the uninsured or the insured or any other issue related to health. The purpose of Obamacare is to force Americans to submit vast amounts of data that can be gathered, collected, assimilated, disseminated, and used for nefarious purposes. Why nefarious? Because government cannot use that data for anything else. It can only be used against you. The secondary purpose of Obamacare is to destroy the middle class by stripping them of their financial resources as this thing moves forward. We will have two classes, two castes, if you will. Yes, I mean castes as in Eastern Indian castes. They have a caste system in India What you're born into, you can never rise above. If you're born into poverty, you must remain in poverty. You cannot break the caste ceiling. And ladies and gentlemen, what we're looking at here is absolutely no different. We will have the political elites, their chosen winners, and the vast unwashed masses beneath them. If you believe that was the vision of the men who and women who created this nation, if you believe that was their vision as they wrote the Constitution and the Federalist Papers to explain it, I don't know where you're coming from. I don't understand how you can believe that. If that's freedom, if that's liberty, if that's mom, if that's apple pie, if that's free enterprise, if that's capitalism, I'm a monkey's uncle. The truth is, the Obamacare program, the ACA, will fundamentally transform healthcare into a weapon of mass destruction wielded by the hands of bureaucrats and whoever is in power. That's why Obamacare needs to be defunded. That's why Obamacare needs to be repealed. That's why the 10-foot stack of regulations that have been written to implement a 2,000-page bill is a declaration of treason on America. This isn't about health care, ladies and gentlemen. This is about controlling you. This is about gaining your data to control you. And this is about sifting through and straining and draining off your resources. You're listening to America's Voice Now. My name is Michael Evans. I'm your host. Find our website at americasvoicenow.org. Find us at facebook.com/America's Voice Now. And then find us also on YouTube at youtube.com/America's Voice Now. You know, I'm going to talk to you about this in the next segment. I got this book from Mary Webster. She is the editor of the Federalist Papers in Modern English. And I have that one and another one from her about the Constitution and how she has tied and annotated the Federalist Papers in Modern English to the Constitution. I want you to study these books. I'm going to offer them for sale on our website. I've spoken to Mary about it, and she's in agreement with it. We're going to offer it shortly. I want you to be able to get a hold of these because they clearly define exactly what our founders were thinking. And that's the argument I'm making here. This is completely and diametrically opposed to what our founders intended.